anxious, very depressed, extremely exhausted. Almost felt like I was detached from the world.
It was just a struggle every day, just to get up out of bed and to care for my baby.
I had intrusive thoughts, yeah. I had those fears like, oh, those are terrible because it comes to your head, it comes to your mind, and you just want to like brush them off. So you try to brush them off, but they don't go.
The baby blues are kind of normal. Most women experience baby blues, maybe 75% of women after they've had a baby. Postpartum depression is more serious, longer lasting, much more intense, and requires help and treatment.
Postpartum depression is something that I went through 20 years ago. It was debilitating, and when I was going through it, the shame that I felt after having a wonderful baby was overwhelming. I remember waking up with contractions and being really happy because I knew I was going to get the baby, and then after he was born, I didn't even want to hold him. So something happened to me right away that I really didn't understand. I could see the joy on my husband's face, and I didn't feel the joy. I was like, where's my joy? I felt like I was selfish. I felt like a waste of a human being. I felt like I wasn't kind like a mother is. I wasn't caring like a mother is. I just never knew I was that selfish, that I couldn't love a baby.
Women should not be ashamed of postpartum depression, and they need to speak out. They need to understand they're not alone and that they can be helped.
I went on the internet and I started putting all these different symptoms in. They came up with schizophrenia, bipolar, this and that. And it freaked me out to the point where I better go to a doctor and let them diagnose me rather than sit here on the internet and scare myself even more. So that's what made me go get help.
I knew I needed to talk to somebody because I had these thoughts and feelings that I just knew weren't right, and I felt like I needed to get some kind of reassurance that this was going to be okay.
I went to the doctor, to my gynecologist, and I say to him, you know, I'm having all these symptoms. I don't have appetite, you know, and I have fears.
I'm here, you know, because I know that it's a very difficult thing that you're going through, and I want to help you.
I knew it was severe. I knew I was in trouble.
Women who are feeling the symptoms of postpartum depression should speak to their obstetrician and gynecologist, the nurse midwife, the nurse practitioner. Any healthcare provider actually is someone that can address or start to address these issues.
After I went through treatment, I finally realized what it was like to be a mother, and I was relating to other mothers for the first time when Kevin was about a year old. I understood the joy that I thought that I would never feel. I started to feel joy, and I couldn't wait to be with him and go to the park with him and do the things that all the other mothers were doing.
Women will recover from postpartum depression if they get into therapy. There are a number of therapeutic options available, including medications and psychotherapy, or a combination of both.
Postpartum depression affects so many women and their families that our nation can't afford to ignore it any longer. There needs to be a place for women to go to get help.
Once I got help, I started to feel better almost within 2 weeks' time. You know, once you realize that you're not alone, you know, you start to get a handle on it.
Well, now my son is 15 months old, and a lot has changed for me. I look at him and I can't believe I felt anything than what I feel for him right now, which is just unconditional love.
I remember about 2 months after I was taking the medication, I saw my baby, and I look at him with different eyes. I look at him differently. It felt so one emotion that I never felt before.
Through counseling and medication, I finally was able to feel like myself again and be the mom I always wanted to be.